Billahiminashaitanirajim. Bismillahirrahmanirrahim. Assalamu alaikum. My name is Muhammad Jamal Hassan and I am student of BSc Honors Human Nutrition and Dietetics of 8th semester evening session from Pir Meher Ali Shah Arid Agriculture University Rawalpindi with arid number 16 arid 4702. Today I am discussing about my internship report presentation and the contents of my presentation are: first of all, introduction to hospital, departments of hospital, disease that I have focused more during my internship, then my case studies, sample meal plan, my learnings, conclusions, and at the end my acknowledgements. First of all, I am going to tell you about the introduction of Pak Emirates Military Hospital. Military Hospital Rawalpindi is the largest hospital of the Pakistan Armed Forces, being one of the hospital in the Pakistan Army with an ISO certification in the city of Rawalpindi. Before independence in 1947, it was called the British Indian Military Hospital, Rawalpindi. Its commandant is a serving Major General of Army Medical Corps. It has one deputy commandant with the rank of brigadier and two assistant commandants with the rank of colonel. Its family wing is looked after by a lady medical officer with the rank of brigadier, and it is affiliated hospital of the Army Medical College and Armed Forces Postgraduate Medical Institute, Rawalpindi. It is a teaching institution for nurses and paramedics. The vision of Pak Emirates Military Hospital is to be recognized as one of the best medical care institution in Pakistan and the developing world. Guiding principles: the Pakistan Emirates Military Hospital operates on the core principle of quality, relevance, impact, and assess. It is a patient-centric institution and strives to provide care that is respectful and responsive to individual patient preference, needs, and values. They also try to ensure that patient values guide all our clinical decisions, and the staff performance is measured against a guiding principle by assessing their communication, attitude, responsiveness, respect, and care. If we talk about the departments, the main department is NFST, and further two subdivisions are nutrition section and food service section. Okay, now I'm going to tell you about the disease that I have focused more during my internship, that is diabetes mellitus. First of all, I would like to tell you that what is basically diabetes. Diabetes is a chronic disease that occurs when the pancreas is no longer able to make insulin, or when the body cannot make good use of insulin that it produces. Basically, insulin is a hormone made by the pancreas that acts like a key to let glucose from the food we eat pass from the bloodstream into the cells in the body to produce energy. All carbohydrate food are broken down into glucose in the blood. Insulin helps glucose get into the cells. There are basically two conditions. One is hypoglycemia and the other is hyperglycemia. If we talk about the types of diabetes, there are basically three types of diabetes: type 1 diabetes, type 2 diabetes, and gestational diabetes, which is also known as GDM. In type 1 diabetes can develop at any age but occurs more frequently in children and adolescents. When you have type 1 diabetes, your body produces very little or no insulin, which means that you need daily insulin injections to maintain blood glucose levels. In 2 diabetes, it is more common in adults and account for around 90% of all diabetes cases. When you have type 2 diabetes, your body does not make a good use of insulin that it produces. The concern stone of type 2 diabetes treatment is a healthy lifestyle, including increasing physical activity and healthy diet. And if we talk about the third type of diabetes mellitus, that is gestational diabetes, it's a type of diabetes that consists of a high glucose level during pregnancy, and it is associated with complications to both mother and child. GDM usually disappears after pregnancy, but women affected and their children are at increased risk of developing type 2 diabetes later in life. I'm going to discuss about some of the most common symptoms of diabetes mellitus that include frequent urination, polyuria, dehydration, increased thirst, polydipsia, blurred vision, increased infection, weight loss, increased hunger, that is known as polyphagia, and the fatigue. Food that I have prescribed my patient to avoid include saturated fats that include meat, fat, butter, creams, cheese, cooking margarine, palm oil, coconut oil, milk, cream, processed snack, and takeaway foods. Foods that are very high in sugars, for example, soft drinks, cordials, sweet lollies, and other sweets. And food containing high carbohydrates, proteins, and fats. And the food that I have prescribed my patient to eat are that food that have low glycemic index, for example, brown rice, whole wheat, quinoa, fruits, beans, lentils, grains and starchy vegetables like potatoes, corn, squash, other root vegetables, fish, green leafy vegetables, cinnamon, chia seeds, turmeric, and nuts. And these foods may be helpful for a diabetic patient. I would like to move towards my case studies. My first patient, his name was Mansoor Ali, and his age was 45 years old. His height was about 5 feet and 2 inches, and the diseases he was facing at that time were diabetes mellitus from 16 years, hypertension, chronic kidney disease, renal failure of 80%, and he was on dialysis, sudden onset convulsions he was facing at that time, and pain in abdomen. If I talk about the biochemistry or biochemical test of that patient, RFT, serum urea is equal to 13.7 increased, serum creatinine 873, which is a highly increased level due to non-functioning of kidney, serum iodine 124, which is also increased level, MCV is equal to 6, which is also increased level, PCV is equal to 0.24, HB was 8.3, RBC level were 3.44, which is also increased level, lymphocytes were 15, that were decreased. Clinical signs and symptoms that patient was at that time showing were abdominal pain, excess urination, and kidney pain. My second case was named Parveen Akhtar, age 52 years, height 4 feet and 9 inches. If we talk about the biochemical test of that patient, the MCHC value was 34.1, which is increased level, platelet count was 75, which are decreased, prothrombin time was 23, which is increased level, protein 45, serum sodium 102, Serum total bilirubin 134. Clinical signs and symptoms were liver cirrhosis at third stage, stomach pain, diabetes mellitus, dyspnea, suppressed appetite. My third case was Parveza Bibi, and her age was 65 years old, height 5 feet and 4 inches. If I talk about her test, the urea level was 59.8, which is increased. Sodium 120, which is decreased. Potassium 34, which is also decreased. Serum total calcium 1.92. Clinical signs and symptoms were renal parenchyma disease, dizziness, hypertension. She was also a post-TB patient, and at that time she was also showing diabetes mellitus. Nutritional interventions that I have made for these patients were: intervention 1, low sodium diet; intervention 2, small frequent meals; intervention 3, low sugar and less refined diet. Then I have calculated their calorie requirement with Mufflin formula: 10 into weight in kgs, 6.25 into height in centimeters, minus 5 into age in years, minus 161. According to my calculation, the kilocalorie requirement for a patient was 1636 kilocalories per day. The menu plan that I have prescribed for one diabetic patient was: breakfast oatmeal, 1 cup boiled egg, 1 green tea without sugar. Mid-morning snack that I have prescribed was chana chaat, 1 cup, seasonal fruit, 1 medium apple. Lunch, dal plus chicken half cup, chapati of 1.6 inches, raita half cup, and salad 1 cup. Mid-evening snack was vegetable 2 biscuits, tea 1 cup, dinner palak gosht half cup and chapati 1. Bedtime snack was milk 1 cup, low fat. It was a great experience for me of that internship in a huge institution. And the internship helped me in learning to discipline myself and to increase my communication skills so that I can communicate better with patients. I have received excellent advice and I have learned so much from the guidance of my instructor that will definitely help me in future. I basically learn organizational communication, NG meal planning, TPN roles, feed pump utilization, team working, professional behavior, and overview of all major disciplines in a good hospital. I'm going to conclude my presentation. The practical learning and exposure was so much satisfying. Working with other institution students was also a great source of learning. Overall, there was a very positive working environment, multidisciplinary rounds, and presentations from senior dietitians was very much beneficial. Overall, hospital system is very much established. Everyone from senior surgeon to housekeeping staff behavior softly and positively to everyone. Park Emirates Military Hospital is establishing specialties in nutrition like endonutrition clinic, oncology nutrition clinic, nephrology nutrition clinic, ketogenic diet for epileptic patients. Acknowledgements. I would like to thank the Allah Almighty, who is the most merciful and most beneficent. My special praises stand for the beloved Muhammad Sallallahu Alaihi Wasallam, who set an example of a right pathway for us. And I'm also grateful to Professor Dr. Asif Ahmed, Director Institute of Food and Nutritional Sciences, for arranging this internship program, and then my faculty teachers for this affectionate advisory and positive attitude made it very easy to understand the process of internship. I express my deepest gratitude and special thanks to Dr. Neem, which is head of nutrition department in Pakistan Emirates Military Hospital, and all other dietitians there, especially Mem Rahat, Mem Rabia, and Mem Marfua. Nobody has been more important to me in the pursuit of this internship program and my modest efforts than my family members, especially my parents and their hardcore prayers. I would like to thank my parents and my teachers. Thank you so much.